welcome to this week's podcast. I'm Dr. Gabrielle Broussard here at the Houston SPCA. Today we're going to talk about arthritis. Before we get to that, I want to introduce you to our pet of the week. Her name is Marge. She's a beautiful 2-year-old female pointer mix. She is a social butterfly who gives hugs and kisses to everyone she meets. So come down to visit Marge and give her some love, and maybe she'll steal your heart. All right. So tell me what questions you have about arthritis.
All right. So is arthritis different from us and humans?
So it's an umbrella of diseases. So that is actually a really good question. Arthritis basically means the inflammation of the joint capsule. So that is something that can occur in humans, as well as our canine and feline species, as well as many others. I think for the topic of discussion today, we're going to focus mostly on our companion animals, so canine and feline.
And then are there different types of arthritis?
Yes, so there are many different types of arthritis for varying different reasons. For the focus today, we're going to focus on osteoarthritis, better known as DJD, or degenerative joint disease.
And how is a pet diagnosed with arthritis? How would we know?
So usually you would have a well-established relationship with your primary care veterinarian, most likely someone that has been seeing your baby since a puppy or kitten on to their mature stages of life. From that point, going to their annual visits, or even some things that you may notice at home. Maybe your baby is slowing down for some reason. Sometimes you can see lameness, which is not always very obvious to the owners. Or sometimes they can just see simply lethargy or just not willing to do things that they're used to doing.
And then for that specific osteoarthritis, the one that you mentioned, what makes it different, or what are the symptoms and treatment for that specific one?
Yeah, so that's a good question. So sometimes from home, owners maybe they have a usually really active, very happy pet that is now all of a sudden slowing down for some reason. So maybe we're taking shorter and shorter walks. Maybe we're not as active in our walks, or maybe not as active at home. If you have stairs in your home environment, maybe we're kind of resistant to go up the stairs like we usually do. But again, sometimes there may be an overt lameness associated with one of the limbs. Potentially there could be some swelling or inflammation at the affected limb, or maybe some yelping. Maybe we're trying to do things, but then we suddenly cry out loud, and then the owner can see maybe externally something is affected with one of the limbs. More so in the vet clinic, we usually start with a distance exam. So we'll kind of observe your baby walk around our exam room. Maybe we might see some lameness, maybe a little bit of tenderness during our palpation part of the exam. We might exhibit some pain. But it can present itself in so many different ways. More concerning ones would be depression or lethargy. Especially if we're in our mature age of life, sometimes we may pace back and forth and we're just not able to get comfortable at night.
And is arthritis something that we should just see if our pet is over 10 years of age, or can it happen earlier?
Absolutely. So arthritis can occur at any stage of life, whether they're a kitten or a puppy, a young adult, or a senior patient. Arthritis is not necessarily limited to an age. With that said, the reason being there are multiple different diseases that can affect the patients at their life stage. So sometimes that can be genetic reasons. Sometimes that can also be whether an acute insult happened and that caused injury to the patient. So the DJD in general is usually divided into 2 classes, whether that's primary degenerative joint disease or secondary. And so primary, that typically occurs with age, which is also very common. We see it in our feline patients. Secondary, the most common, that's usually due to some sort of etiology or insulting factor that affects the musculoskeletal system.
And are there certain breeds that are more likely to get arthritis?
Well, arthritis is not necessarily limited to any particular disease, so by no means any canine patient or feline patient can acquire this disease complex. However, there can be some breed predilections. So your large breed dogs, whether that be a German Shepherd or your Mastiff type of breeds, really, really big guys tend to potentially have some sort of arthritis that can occur earlier on in life.
So I guess the bigger they are. So with that being said, if a dog is overweight, does that, affect arthritis?
Yes. So with the babies that are over the ideal body condition scores. So we think about it on a 9-point scoring system. So if they are over 5, which is ideal BCS out of a scale of 9, we can start to potentially appreciate some signs of arthritis there. So again, arthritis is an inflammatory disease. Obesity is also an inflammatory disease. So the more weight that we're putting on our joints, especially when we're on the higher end of that scale, that can really cause some wear and tear on those joints for these guys.
So we have a senior dog that is overweight, that's like double negative. How do we balance that arthritis pain with an exercise to lose that weight?
Yeah, so everything is a gradual process. So when you're taking your babies to the annual vet visits, and we're talking about our physical exam findings, by no means are we trying to be insulting, I promise. But just for the complete health of your baby, we just want to make sure we have the optimal quality of life. So we may mention, let's cut back on the treats a little bit. It seems like we have a significant weight gain from our last annual visit that happened. Or we may potentially do a formula that will help calculate what the ideal energy requirement is for your patient versus what the baby is actually being fed. In some cases, obesity can be caused by many different things. We would, of course, investigate, is there something physiological that's causing the obesity, or is it because we're just kind of getting too many calories throughout the day? Either way, again, we go back to that formula. We give you a dedicated feeding plan, and sometimes we might have to use prescription diets as well to help promote that weight loss and keep you at that ideal body condition score.
And then if a pet is diagnosed with arthritis, what are the different plans for alleviating that pain?
So it definitely depends on our life stage. Either way, we would always offer the client the gold standard. A lot of it consists of a multimodal approach to treating or managing arthritis. So I'll say there's not necessarily a cure for it, but we provide things that will help keep the patients comfortable. So whether that be going back to that diet, a good dietary plan to help promote that weight loss. If that's something that we can target, we'll start with that first. When the joint disease is very severe, though, and there's actually underlying pathology, whether that is some sort of ligament tear, whether there is a previous fracture, or is this associated with that primary joint disease where age is the primary factor, we start to discuss multimodal pain medications. So usually that can look like anti-inflammatories. Sometimes that can be some form of laser therapy. Other times we can give or recommend some sort of supplementation to the diet, and that can be in the form of injections that'll help kind of manage the pain. Again, not reverse it by any means, but kind of help manage the progressive disease. But usually in the veterinary setting, that means pain medications.
And are there any food or lifestyle that we can do from when they're a puppy to kind of help prevent arthritis?
Well, prevention is definitely key. I feel like, unfortunately, arthritis, again, if you have that genetic disposition, would potentially happen to the pet regardless of what you try. And of course, puppies are very young, active, young adults, depending on the job of the animal. That goes back to that secondary joint disease kind of category there. But I think the most important thing is establishing a good relationship with your veterinarian and discussing, this is the breed of animal that I have, what is the optimal food that I should feed this my baby. So if it's a large breed animal, we definitely want to talk about diets, related to large breed dogs. And especially, again, the life stage that it's in, a young animal versus maybe a senior patient. Those nutritional needs will change. Joint supplementation is something that potentially could be effective. However, discussing with your veterinarian what best supplement there is to kind of help promote a healthy joint or joint spaces, because not all supplements are the same. So just remember that. A lot of things can be over the counter, may not be as effective, but also a lot of times are also not FDA regulated. So we just want to be careful, making sure we're maintaining that relationship with our vet for proper guidance.
And then are there things I can do at my house to help my pet that has arthritis like live a better life at home?
So if you have a baby that is in their mature setting of life, and you're starting to notice that they're slowing down a little bit, maybe Rusty is not able to go on as long as walks as he used to be, or maybe he's not jumping up and greeting you at the door as always. There are some things that you can do. So maybe incorporating things like pet steps or ramps to help our senior patients get up to maybe the bed or on the couch. I would definitely recommend, if we know that we're appreciating difficulty going up and downstairs, potentially putting up baby gates, just so that we don't allow the baby to have free access up and down the stairs. Otherwise, things could happen. Sometimes there are adhesives that you can place on the paw pads when you go on walk, or simply when we're wandering around in the house. If we get really slippery and we can't just keep our balance, sometimes those adhesives will help prevent slips and falls.
And what is the usual life expectancy for a dog that has arthritis?
So if well managed, I definitely feel like you can still have a good quality of life with your companion. And it also depends on the type of arthritis, because degenerative joint disease is not the only form of arthritis. There are others that can be definitely more serious. And it also involves the immune system. So I think it really depends on the type and the management treatment plan that you have, which your veterinarian will help kind of assist in a good quality of life there.
And I guess, how would we know the pain is kind of too much? Would you, for your personal pet, determine if the good quality of life?
So I definitely feel like, your baby best more than anybody. And just seeing that baby day-to-day basis, noticing those changes. Maybe we're not able to make it to the restroom in time, make it to the backyard, just because we're having difficulty rising and getting up, or it's just too painful. So now we're having accidents in the house. That also goes back to the walks that we take, if we're just no longer interested or getting excited when we get the leash out, or when we hear the door open, or we're just kind of laying there. Sometimes, again, that whining out in pain, seeing all those things can be definitely hard to appreciate and kind of see your companion go through those life changes. But I feel like your animal best, so you will definitely be able to appreciate something is not right here. Maybe Rusty is now feeling really uncomfortable at this point. All right. Okay, so before we wrap up, I definitely want to announce some exciting news. Opening of our wellness clinic. We are here to offer affordable preventative care to the public. The clinic is open Thursday through Sunday from 10 a.m. to 5:30 p.m. And you can definitely find out more information about scheduling and things that we offer at HoustonSPCA.org. And going back to March, be sure to come and visit us at our adoption center. We're open 7 days a week from 11 a.m. to 6 p.m. Address is 7007 Old Katy Road. Hope to see you soon. Thank you. Bye.